Hi everyone, welcome to our video on how to book patients for admission. So in our previous video, we've talked about how to admit a patient directly from the clinic right away. But sometimes you may want to book a patient for admission in the future. So let's take this patient, Owen Morgan, for instance. We've seen him in our clinic, he's on our outpatient waiting list, and we want to book him for surgery in a month's time. Here on our toolbar, we see two buttons. We see Admit and we see TCI. TCI is a shortened term for to come in. This TCI button is what we'll be using to book our admission. I'm going to select TCI and I'm going to search for Owen's name and his date of birth so that the system can bring him up. Now that I see Owen, I can click select. The system will ask me to record a referral for Owen. So remember, anytime we want to move a patient onto a particular waiting list, we have to do a referral. So that's what we're doing now. We don't have to fill out everything, but we do have to fill out our referral source, the specialty that we're referring him to. In this case, it'll be general surgery. And the admission method. Where is he coming from? In this case, it will be elective or outpatient clinic. Either one works. We can add any notes if we'd like and select OK. Now the system is asking me if I'm duplicating a referral for this patient. Owen was already being seen in my clinic, so he has a referral as an outpatient to my service. However, this time I'm focusing on giving him a referral to become an inpatient. So in this case, I do want to do a second referral, so I'm going to click yes. Now I get another pop-up that says create intended admission. This is where I adjust all my booking details. Certain things have been pre-populated, like Owen's name and the referral and the intended management. I will change a consultant, however. In this case, I'll be using a generic general surgery consultant. And our treatment code, I can also choose general surgery. Now we have this area called ward bookings. Here's where we can say what ward we want Owen to go on. On the right hand side, I see a plus and a minus and a pencil. So I can use this to select my ward. If I select my plus sign, I can add a ward booking. So I can say what dates I want him to come in. In this case, I'll say the 8th of May and the time. And if I want to say an end date, I can as well, but I'll leave that blank for now. I can also choose what ward I want him to go on. I'm going to use my magnifying glass to select a place. In this case, I'm going to choose Ward 1 General Surgery. I can see that we have 17 free beds currently. Then I'm going to click OK. If I have any notes around his booking, I can add that here as well. Then I'll select OK, and we can see his booking here. If I wanted to delete this, I can select a minus. If I wanted to edit it, I can select the pencil button. I can also see below there's a checkbox talking about whether or not the admission date was confirmed with the patient. In this case, I'll check it to say yes. You can also print an admission letter if you'd like. I'm going to select OK. And now he is booked. But let's talk about how you can confirm that. So we're going to go to our inpatient overview. How we get there is by going to hospital overview and selecting inpatient overview. Here in our expected admissions tab, we can see that we have two patients, Fiona, and we also have Owen. We can see Owen's date of birth, who's managing him, what ward he's going to, and the expected date that he's due to arrive. So let's recap. We've talked about how to create an intended admission. We do that using our TCI button in our toolbar. We're required to create a referral and then to perform a ward booking for our patient. In order to confirm that our patient has been booked, we can go to our inpatient overview where we can see their name and the date that they're expected to come in our expected admissions tab. Thank you very much for watching.